Everyone in our community deserves to receive care in facilities that are not just modern and efficient, but also inviting and perhaps even inspiring.
We are the fourth largest safety net healthcare system in the country. We believe that it's important to have a public safety net healthcare system so that you can come to your hospital, the People's Hospital, and the doors will be wide open for you and you will be able to receive the finest care available.
To put sustainability practices in place very early in terms of the design process was an easy decision to make.
A hospital, by its nature, uses an enormous amount of energy. Our consultants have been brilliant in figuring out ways to use less energy, less waste. We brought consultants together and asked them to design a hospital that would be at least LEED Silver certified.
LEED stands for Leadership in Energy and Environmental Design. It has to do with energy usage. It has to do with things like green roofs. It has to do with sustainable site design. So it's a very encompassing process with very specific things that we have to achieve.
And they asked us, well, do you mean that just the buildings or the entire campus? And we said, oh no, let's see if we can do the entire campus. But later we were told that no hospital in America had ever, for the entire campus, been LEED Silver certified, but that it could be done. We hope to say that if a hospital campus can be LEED Silver certified or LEED Gold certified, then certainly so can other buildings as well.
One of the key aspects of Eskenazi is that it be as healthy as possible for the patients, the physicians, and the staff. A lot of hospitals recirculate the air. 100% of all the air within the hospital and the ambulatory care is brought in, it's used, and it's exhausted. In this case, we recirculate none of the air.
We're using the beauty and grace and elegance of natural light. We've designed the building so that if you are a patient here or you're a family member, you're going to be absolutely flooded in natural light. Just having access to all that natural light is important for the patient's mood, for the patient's optimism, that's going to help that patient heal better and heal faster. And we know that because medical evidence shows it.
It is important that there is a complete collaboration amongst nurses, physicians, the design team, and those of us that support them. All of staff really had the ability to be part of the design meetings and make sure that things that they wanted to be here are here.
We did a concept called the mock-up rooms, and we started just playing with scenarios and how we thought equipment and things should be laid out. Things like the colors of the room, the actual furniture in the room, the beds, the staff all helped to engage in that process.
Our patient rooms are a great example of how we've, again, focused on healing, on promoting health, both for our patients and for our staff.
All of our patient rooms are same-handed, meaning they don't mirror image themselves as they go down the hallway. We believe that means that everything is in the same place in every room. We believe that'll lead to fewer medical errors.
The rooms that the patients are in are all private. They have enough space to support having family and loved ones with them during that time. The flooring and the ceilings and the wall coverings absorb noise, so the noise level here is much different than what we had before. One of the other unique features about the patient care rooms here at the Sidney and Lois Eskenazi Hospital is the patient lifts. Each and every patient care room has a lift in the ceiling that will support the patients safely to move in and out of bed if they need that assistance, or to turn from side to side.
The patient lifts are designed for the safety of the patients as well as for the safety of the staff. It actually decreases injuries to our staff members. I personally love the lift systems.
Sky Farm is the place where it all comes together.
The Eskenazi Health Sky Farm is approximately 5,000 square feet of growing space on the roof of the outpatient care center. I think the impact of growing food so visibly is that people have an opportunity to engage in a relationship with food in a way that's very different from going to the grocery store or driving through a fast food drive-through lane.
We see the Sky Farm as a growing and a gathering place. All the elements of health come into focus on the Sky Farm.
We are what we eat, and so food is such an important part of creating our own health. It gives people an opportunity to see a way that they can really step into taking responsibility for their health and well-being.
Common Ground is a space that is actually defined by two significant fountains. One is called the Falls, which represents the materiality of the Indiana landscape in the form of beautiful limestone blocks. And on the opposite side of Common Ground is the Healing Waters. It is a fountain that wells up from the ground and then recedes back into the ground again and can be experienced by running through it and touching it. And it's a wonderful cooling feature. There's also a cafe and a trellis under which people can sit. It is beautiful to see people sitting under the dappled light of trees, entering into conversations, sitting contemplatively, walking through water. It is the most spectacular conclusion that could take place here at Eskenazi Health Campus.
This is more than a collection of buildings. This is an idea about what might happen when a community comes together the way Indianapolis came together.
After we concluded that the most economically prudent way to proceed was to build a new hospital, the Indiana General Assembly passed a new law that required governmental entities like us to prevail in a referendum. People from all over the community came together, and we did over 200 community meetings about why this was important, how we were going to fund it, and what it would mean to have a new hospital and what it would mean if we didn't have a new hospital. When the votes were finally counted, 85% of the voters voted yes. And on that night, November 3rd, 2009, I have never been more proud to be a resident of Marion County and the city of Indianapolis.
The artwork here is incredibly integrated into the architecture and design of spaces. Those artists represented a wide spectrum of style, of background, ethnicity, and we were very proud of where we ended up.
The care that we provide in this community is absolutely essential. The only reason we are here is because the people of our county and our city believe that it's important to have a public hospital, and they have believed that for over 150 years.
Our overarching goal is to be the health system that is known as having improved the health of its community, starting with itself.